Hello guys, today is 26th November and happy Constitution Day. I'm with new question today with context of National Family Health Survey which you find today in news. So after reading data, I've crafted the old question of UPSC to suit today's context. And the question reads out as India needs social norms based intervention at every phase of women's life. It says every phase from being natal, then young girls, maybe married women, old, everyone. And it is asking for social norm based. When we say social norms, it's how traditions and local practices are needed to be influenced at every phase of women's life to overcome and address burden of anemia. And the keyword here is analyze. So if you look at this, something that demands more attention is anemia. This is slightly a specific word that we need to be targeting at. So our answer should revolve around anemia. So let's get into the answer without wasting much of time. So in introduction, what could be a better introduction? As they were asking about anemia, it would be great if you are able to uh, produce some data regarding anemia. That will bring proper introduction and more appealing one as well. From where can we get a reliable data which adds credibility to our answer? National Family Health Survey. That's the reason I chose this question today. So National Family Health Survey says though there are some radical changes like uh, sex ratio has improved. Sex ratio is uh, more than 1,000 in good number of states. So it sounds to be a great situation. Yet, despite this condition, around 53% of women are anemic. So many people bring data, but the comparison and the contrast that you find in two data by similar survey or the same survey, at one side we have something positive, on the other side in the same survey you have negative, which is not so good thing. So that aberration or that deviation has to be captured. So this will form a proper introduction. In the end, let's look at the answer. You might get much better clarity about how this introduction could pan out. Then remember, this is more about what you do with the social norms, not like bringing some exceptional things, but bringing social norms. So, what are causes for anemia? I think most of you know what is anemia. It is a reduction in hemoglobin levels in blood. So what will that result in? What will that reduction result in? It will bring fatigue, it will bring stress and diminished productivity. So is just hemoglobin level enough, or is it interlinked with something else? Guys, with health, nothing goes individually. Vitamins, microminerals, and some other nutritious value are interlinked, and one we need one element to absorb the other. So whenever there comes anemia and hemoglobin level, you mentioned two things. One is folate, other is vitamin B12. So this goes along with the iron content. So these three things with deficiency of one will affect the other. So this broadly forms how your introduction should be with the data. And then see, here we have introduced with data and contrasting data. Then we formed a link to go into body. Entering into the body, we now seriously enter that arena which matters the most. So in body, we speak about what are the factors. So we speak about at various phases. You have undernourishment right from birth, maybe when your kid, uh, especially a girl child, is undernourished severely among the poor family. We are speaking about social norm responsible for this, maybe patriarchy. This is something that should be blamed for most of the reasons. Maybe sometimes even when men suffer, that they can't cry, they can't be weak. So that patriarchy could be blamed. You can put blame on patriarchy for undernourishment since birth, because women usually eat last. Human consume last after all the family members uh, consume. So that is this might result in fertility preferences, fertility preferences, and there are some practices, of course, that might have been very much less. Still, girl child are fed less. I mean, breastfeeding is less to girl child compared to their son. If they have two kids, two infants simultaneously, so that will also matter. Now, what can we do to address this situation? To check societal norms, you can't bring a policy at a national level and do that. This has to be very much decentralized, connecting to the ground level, and if possible inspections passively. And again, I reiterate, passive inspection because this forms their private life. Uh, you can you can't publicize them. So the passive inspection by maybe Anganwadi workers or Asha workers or maybe anyone at that ground level workers could be used. So that kind of a ground level inspection will to some extent help influence or nudge towards some behavioral change. Then one more problem, actually the gravest part of the uh, situation that is existing in India is that many women don't acknowledge that they are anemic. They don't think they are. So this is all about perception that people develop. Unless the situation is very serious, they are not recognizing it. There's an interesting survey conducted by an NGO. The survey was about asking a particular sample size of women about what do they feel whether they are anemic or not. They say most of them were like, we are healthy, but when tested they were anemic. So there is less acknowledgement or less identification at early stage that they are anemic. So unless you identify them at the right time, you can't address that scenario. So that is one thing. If possible, a periodic free checks which could be done. See, a blood test in reality, uh, see, the corporate charges would be very high, but in a government hospital, if you want to really check, all that cost is 2 rupees. The strip cost 2 rupees to check whether you are anemic or not when you are checking at larger scale. So I don't think that would be major expenditure to periodically check whether a woman is anemic or not. And many times, of course, uh, most of the women go through the cycle of motherhood in their life. During pregnancy, uh, it's a peculiar condition that gestational, they find diabetic themselves, and that is called gestational diabetes. And the condition would go away as soon as they conceive. So, this gestational diabetes, this gestational diabetes is also responsible for the anemic condition that results post pregnancy. And there is a simple solution to take some 15 mg of iron tablets, which could be an addressing solution for few months. And it also takes care of the fetus or the baby. That could be done during pregnancy. So this can be a good solution if done properly. And again, what are the social norms? What are the common things that you can do? Because government already tried to make some efforts with ICDS scheme, I think ICDS midday meals are very much famous, and all over India, you know that. And there was a campaign which was calling Anemia Mukt Bharat. So that Anemia Mukt Bharat may be successful for some extent, but largely it didn't achieve its objective. So, what are problems? It's because the misinformation that hardly one third of the women take that IFA tablet for a course of 100 days. So, this reveals that an 50% of National Family Health Survey reveals the contradiction results. Now, can we find some social practices as suggestions? We can give something like, uh, okay, there is a practice like Khanya Bhojan, which is practiced in most of the states during Navratri. Khanya Bhojan. Uh, Definitely, if you know that, you can just comment if any extra information. During Navratri, young girls are fed uh, food during Navratri. So that practices, if inculcated at large scale, can help. And if any local tribal practices can help, because I personally believe it's not the literacy rate, but the intelligence or emotional intelligence that, or the common sense that people develop to see a woman to be nourished properly matters. In my own district, where I come from, women literacy rate is 47%, which means not so great. Still, our women in our district are not that anemic comparatively, because they were closely connected with local practices, and those local practices that came from days of yore ensured women are slightly more nourished because of the consumption of jaggery or some other natural foods which will ensure uh, they get enough nourishment and enough iron intake during menstrual days. So local practices has to be part of your diet. And instead of uh, intake of large number of carbs in form of rice and uh, wheat, shift towards millets. If millets form core of your diet, probably that can address or at least reduce the severity of problem. So one last problem I would like to discuss is the same National Family Health Survey from where we took introduction data says that only 22% of women are able to take their decision independently regarding the health. So, guys, please do compile this data, make observations, and you'll find some interesting findings where you can use in your answers to back up, add credibility to your answer. And very few women receive antenatal care. Prenatal care, yes, but antenatal care is becoming very less. Being in unorganized sector, women can't afford maternity leave more than 90% of the time. So these were something I would definitely like to mention. So before going to conclusion, let's just look at the answer, how we are presenting. So as we said, we we exactly presented the data of National Family Health Survey to begin with, and then bought a linking paragraph where we can enter body smoothly. Spoke about iron deficiencies, linkage with folate and vitamin B12, and which may lead to fatigue, stress, and some may result in serious conditions like cardiac arrest as well. Then we jumped into the body. Instead, we smoothly ensured our transition to our body is good. We thought about behavioral factors that are entrenched. We spoke about undernourishment related to patriarchy. Then we specifically gave example of women eating last in their families, and we spoke about those menstrual days where the intake matters a lot. Then we gave a kind of solution where we spoke about Anganwadi workers who could do a passive inspection. Moving forward, we spoke about the perceptions. I mentioned about that NGO survey. So you can see how the psychological byproduct causes paleness. Then we spoke about gestational diabetes. These things add an uniqueness to your answer. We commented, critically analyzed, though the question was speaking just about analyzing some elements were critical, and where we commented about Anemia Mukt Bharat scorecard, and we found out some contradiction and aberrations from National Family Health Survey of 4. Uh, the one which we are speaking about was 5 in other cases, but this is an old survey which found those aberrations. Then we spoke about lack of agency, where only 22% of the women take decision of health of their own, and this is also an old survey, so these are interesting things. And we spoke about antenatal care becoming very less. Also, these unorganized sector women are facing a situation where they can't afford maternity leave. How inhumane it is that in 90%, the figure is as high as 90% of women working in unorganized sector are having the situation of not affording a proper maternity leave. Then we would go to conclusion to ensure complete the answer in 10 minutes for 15 marks. We write conclusion with a proper long-term vision and horizon. Long-term investment in health of women that is bought through change in behavioral yields great dividend as it leads to many multiplier effect. So we indirectly meant to say you can consider this as a capital investment to neutralize patriarchal effect or on women. And as this is a specific situation and a great crisis that we are facing, we can link that pandemic situation. I mean, pandemic hemoglobin is essential for lasting oxygen saturation levels. So this is how you can link and produce a proper answer. So on this note, I think we added some value in this 20 odd minutes, and it's worth watching it. Till the time we meet you next time, bye bye, and once again, happy Constitution Day.